When you hear the term vaginal loss, it basically means exactly what it means. What is coming out of the vagina? We will ask you often, have your waters broken? Is your pad wet? Your knickers wet? Was your bed wet? Was your seating wet? Is there any spotting? What colour is the spotting? Is there any discharge? So the things, the reason why we want to know this is to ascertain the reason why you've come into the hospital and what it is that we're looking for. As when you become pregnant, it is normal to have vaginal discharge. It should be kind of clear to straw, creamy coloured. It may have a bit of a thick consistency to it, and that will happen throughout your entire pregnancy. It can become watery towards the end of the pregnancy, when you're due to maybe give birth, around that time, and when that happens, you often can't tell whether you've wet yourself or you're just sweating down there, or have your waters gone. So definitely recommend wearing a pad throughout your pregnancy, so that we can capture whatever is there. So if you have concerns, you've got evidence of what it was. And I know it sounds really weird and disgusting, but we really don't mind looking at your knickers or your pads or whatever it is. There's no judgment. We want to know these things because they help us to determine what's going on with you. If the discharge is itchy, it could be that you have thrush, so let's get that checked and commence the necessary treatments so that you feel comfortable again in the pregnancy. Sometimes it can be brownish, which is old blood that was lying within the cervix or even within the vagina. But it's still, if you're concerned, it's still good to let us know. Anything foul smelling, green, could be an infection, so let's get that checked. And any red spotting could be blood, and that can happen for a number of reasons, which I'm not going to go into right now because I don't want you to then start self-diagnosing. So the point is, if you see any blood, let us know and let's get that checked. It is vital. Okay, I hope that helps with regards to working out what's coming out of your vagina and is it normal and is it not normal.